Welcome to the NorthLakes podcast. I'm Jeremy Oswald, part of the marketing department here at NorthLakes Community Clinic. And today I'll be speaking with Dr. Lorelei Wakefield from our clinic in Park Falls about chiropractic care and pregnancy. As usual, I came into the conversation with an idea of what we would talk about, and we did, but Dr. Wakefield was able to broaden the talk and take it to a place I hadn't thought of. I also hope that the fact that I'm a man talking about pregnancy didn't get in the way of the conversation. I don't think it did, but I do want to acknowledge that fact. I'm a man talking about pregnancy. I hope you enjoy it and that you learn some things. I did for sure. So let's get to our talk with Dr. Wakefield.
Well, thank you so much for having me. I'm looking forward to speaking on this topic of chiropractic and pregnancy. But I'm a doctor of chiropractic. I have been a doctor of chiropractic since 1989. I have been in Park Falls, Wisconsin for 33 years. I have been with NorthLakes now for 3 years. So my husband and I owned the clinic in Park Falls. It was Chiropractic Health Services at the time. We then got together with other chiropractors and had a large corporation called Allied Health for 15 years, and now we are with NorthLakes up here. So I have been a doctor of chiropractic, like I said, for 33 years. I'm also a mother and have 3 sons. So not only do I know pregnancy from the aspect of being a doctor, but I know it from, experience myself with being a mother and having 3 labors and deliveries.
I imagine that's got to be very helpful when you're talking to your patients.
It's very helpful. Yes, it's very helpful as well. Not that they just listen to me because I'm a doctor, but because I'm a mother as well. But I have a lot of good information then to give them from my experiences, yes.
And the first one thing I want to know how you like this new building. I love coming here. I don't want to say I didn't like your other building, but this is so amazing. You have this big new building here in Park Falls. How's it going in this new location?
Oh, it's wonderful. And if anyone who's listening knows the Park Falls area, we're in the old, I say First National Bank, but it was the Forward Bank after First National, and they built a beautiful building up on Highway 13, and we've been blessed to have this building. And yes, the space, to have windows, it's a very nice building. And yes, our old one, we had just outgrown it. We had outgrown it before NorthLakes took us over. And so we're very thankful to be in this one. Yeah, it is. It's wonderful.
Well, I'm really excited when we're done here for me to be able to walk around a little bit and see. I was here when you were kind of moving in, so I'm excited to see how you've settled in and checked the place out.
Yeah, and of course there's other things they're going to update as well, but it's really fun to have these vaults, and, it's just kind of a neat building. Mm-hmm.
Yes. So thank you so much for talking to me today. We wanted to talk about the relationship between chiropractic care and pregnancy. And what I first wanted to ask is, why should someone who is pregnant seek out chiropractic care?
And that's a really good question, because I think most people when they're pregnant think, well, I really don't need chiropractic care unless I have a symptom, meaning that if I have low back pain that might be related to it, that's when I should go in. But what I've educated a lot of my young females who come in who are even thinking about becoming pregnant is I say you really need to start chiropractic care before you decide to get pregnant, so that chiropractic in itself will help to make sure that the spine is kind of in a normal balance as well as the whole body. So chiropractic as a whole looks at health from the inside out. So when we do things, and most people know us for adjustments, so we look at the spine, and of course the nervous system is what regulates the whole body. So with regulating the whole body, what we do with adjusting is we try to get the nervous system as well as the spinal joints to balance out to a point where the body is at its best balance or homeostasis. So when someone's thinking about becoming pregnant, a lot of times they aren't educated on what needs to happen within their own body to even get pregnant. So we do what we call a wellness exam to check the spine and other things, as well as then I educate them on proper nutrition. So a lot of times I'll say you can start a prenatal before you start prenatal vitamin, but along with that, they need probiotics, they need omega-3s, and they also need usually a vitamin D because they're usually deficient in those. So that's how I'll start. And then, of course, if they do need some spinal adjustments, I will do that as well.
So to start with, you're kind of setting the stage, like setting the, creating a safe, good space for a pregnancy.
Right, because, as a female, even before you get pregnant, there's not a lot of information out there on what you should do. I also look at their sleeping habits, their water habits, and, of course, exercise habits to see where they're at with that and see what we need to work with. So then, from there, though, it's not like I need to adjust them on a regular basis. I start that. Then what I educate them on is that if and when they become pregnant, that they should really come in right away, and then we'll go from there. And I educate them again on nutrition, sleep habits, water, and then any other questions that they may have at that time, and then usually with adjustments. And then hopefully I can manage them on a monthly basis, kind of like what they go through with a regular medical doctor, except, of course, I'm not doing the same type of care. But with that, then I help to educate them on different stages of the fetal development, as well as making sure that their pelvis stays level, decrease their chances of headaches, low back pain. And then if they develop any symptoms, then we work with that. And so I may see them on a regular treatment plan, shall we say, instead of on a monthly basis.
And so that's funny. When I was thinking of speaking with you, I didn't even consider like kind of the beforehand. My first thought is like, thinking of a woman who has like extra weight they're carrying around and the strain on their back, but you're already thinking like way ahead of time, like not this obvious thing that I thought of.
Right. Mm-hmm.
And so as it goes on, like, what happens? I mean, there's this, big shift in a woman's body. There's this center of gravity changes, so many other things. Like, so then what happens? How are you able to help out? And I'm sure it really benefits for someone to come beforehand, but I'm also going to guess you're going to get some people who didn't do that prior, and they come in help me.
Correct. So then if I get so your question, and I understand it, is that when you think of a pregnant woman, you're thinking, of course, they're going to have back pain because as they get larger, gain that weight, and that uterus changes, what you'll find is that the lumbar spine, the low back, of course, you're going to get an increased curve in there, as well as the hormones that our bodies produce increases the joint laxity. So then they have a lot of mobility in the area of the pelvis and all the joints, and so we can say they're almost looser, so their chances of developing issues with the pelvis as well as even between the mid-back, because breast development usually changes. And then I'll go into how the spine, everything changes. So, of course, it isn't just low back pain. They'll get it between the shoulders a lot of times and in the neck. But you're right. I will get pregnant women in who will come in at this point and say, I've got all this low back pain, and they may be as early as 12 weeks, so it isn't that they've developed such a large uterus or, so much weight forward at this time. It may just be that the joints have become that lax due to the hormones, and so it's shifting, and then they become restricted. So if someone comes in, a female comes in, even at that time or later on, I will do an exam to see where the pelvis is, and a lot of times we're going to find that, our pelvis is our iliums, and our iliums are what we put our hands on when you think about putting your hands on your hips. And it makes a joint with your sacrum, which is the bottom of the spine, or shall we say, right in the butt area, and that makes our sacroiliac joint. That's usually the joint that I will find is really restricted on one side compared to the other. And so our pelvis, of course, is really changing and becoming more forward. And then depending on how large the fetus is and where it's sitting depends on if one side is restricted or low, we'll find. So if I look at somebody and they're standing in front of me and I see that the pelvis, or I feel that the pelvis is, let's say, lower on the left, I know that that ilium has gone forward and inferior. So if you think about when we walk, our iliums or our hips go front and back, right? So if you have a pelvis that's lower on one side and it's gone forward and downward, when we walk, it's almost like you've got a catch or a hitch on one side. So then what happens is that the muscles in that area try to protect that joint from moving because it looks at it as an injury or something that isn't right. So it'll cause muscle spasming on that side to keep that pelvis from moving, or that side from moving more, as well as sometimes it can bring inflammation to the area, or it can actually create, shall we say, stress or irritation over the sciatic nerve, and it can give you leg pain as well as butt pain, as well as the tightness of the muscles. So there's a lot going on. And so with this is what I check out. I also, of course, check into the mid-back, because as the lumbar curve becomes more forward, the thoracic or mid-back area, that will increase and go posterior and become larger. And then our head will become a little more anterior. So those joints can all have issues as well. So I check all the way up, even if someone's just coming in with low back pain. So with that, when they come in, and of course I adjust them differently than I do someone who's not pregnant, but a lot of times once we get that pelvis moving, first of all, they feel better, the pain will start going away, the muscle spasming will decrease, and then I educate them on what they need to do exercise-wise or stretching to stop some of that, as well as ice or sometimes heat. Not usually heat, it'll usually be ice. But so those are the things I work with.
Oh, they must feel so much relief after seeing you.
They do. And the nice thing is because the pelvis or the joints are laxer, it's not a forceful adjustment. It's not, usually a tough adjustment. What do I want to say? It isn't real painful is what I'm saying.
You're just kind of putting things back in place.
Correct. But with that, because a lot of times their question is, how would this happen? Well, you have so much laxity, the way that you sit, the way that you lay, the way that you walk, the way that you carry things. What does
laxity mean?
So,
sorry.
That's a very good question. So the hormones, especially the oxytocin that our body produces when we're pregnant, it relaxes or creates looseness into our soft tissue, especially the tendons and ligaments that hold our joints. So it makes them a little bit more elastic. And so because of that, they don't hold the joint as tight as they normally would. And that happens, and it has to, so that the body can change in posture.
Got it. Okay.
Yeah, so that's what it is. And some people can have it without being pregnant. You know what I mean? They can have increased laxity due to, age, growth. Some people consider themselves to have a situation that they have hypermobile joints, and I don't know if I have an explanation for that. But this is due to hormones. And so because they're looser, they could sit for a long period of time and sit on one side more than the other, and that can create the pelvis to lock up on one side. They can walk for long periods of time, and that pelvis can just be loose enough where it will restrict itself.
And this, do you collaborate with other providers during someone's pregnancy?
I do. With being in the area, as long as we have, sadly though in our area we don't have anyone who delivers babies in Park Falls. They go to Minocqua, they'll go to Ashland, they'll go to Medford. But I have worked with some of these OBs. I've certainly worked with pediatricians, and then some of the doulas and nurse practitioners, midwives in the area as well. But if there's something that I am not comfortable with, or I think that they need to have other care, or that I think that their OB should look at, I will certainly discuss that with them as well as their provider.
That must be really nice to have kind of a team. Like, that must be nice for whoever's pregnant to have, like, a lot of support from a lot of different people.
It is. And with also me being a doctor of chiropractic who has treated a lot of pregnant women and being a mother myself, the other thing that I do with educating them, so if they come in at any stage of their pregnancy, and I discussed in the beginning about nutrition, and so sadly I'll say that, and it's not the medical profession's, what do I want to say, forte to always know what the educational needs are. But because I'm really versed in nutrition, as well as being a mom who was pregnant one time, that to understand that besides a prenatal, which a lot of them do, they need to understand that they need a probiotic because so much of our gut health is dependent upon, obviously, our food intake, and a lot of nutrition is not good these days. A lot of these mothers haven't been educated on what they need to eat, so they may not be the best eaters. They may live off either fast food, processed foods, sodas, sugars, and so a lot of that will destroy your gut flora. Well, the gut flora, which is, I say, either the hair or the good bacteria in our gut, if we don't have enough of it as we are developing a fetus, the fetus doesn't develop proper gut health. And so gut health is so important for our brain and nervous system development, because if you don't have the right flora, the body does not utilize the nutrients it gets. So a lot of these mothers I educate and get them on a proper probiotic that may have a prebiotic along with it, or I educate them on foods they can eat. You know, rich foods of probiotics are kimchi, sauerkraut, fermented foods such as yogurts, cottage cheese. So I will educate them too if they really don't think they want to supplement on what they can do to eat, what foods they need to eat. And then, of course, omega-3s or your fish oils are so important because that helps to develop the nervous system as well as the proper cell walls. If we don't have enough of the good fats in our system, our cell walls will not be lucid, or shall we say fluid, like they should be, meaning that we need to have a real liquid cell wall for all of our cells so that the cells can get the nutrients they need. Okay, if they have a, shall we say, not as elastic cell wall, the nutrients can't permeate it, and then the cells cannot get the food they need. And so we have, sadly, a Western diet that's full of trans fats, omega-6s, and the wrong fats. So I educate mothers on this so that she has better health, and then the child's neurologic development will develop better as well.
And that's some of the things that you'll do even before someone becomes pregnant. You'll kind of like it, that's the help setting the stage.
Correct.
Do some of that. What would you nutrition advice, nutrition therapy? What
it's nutritional counseling.
Thank you. Mm-hmm. Excellent.
Yep. So that's what it is. And mothers really want to absorb as much information as they can to help them through their pregnancy, as well as to help develop the fetus.
Well, you were saying that there's nobody delivering babies here in Park Falls.
Correct.
And I just have to imagine that you're such a great resource. Here someone can come to you, maybe not have to travel to one of these other communities that you were talking about, and they can come and get real good advice. They can get good attention and care about their pregnancy right here in Park Falls.
Correct. And as you're saying, so it's because of my years of knowledge as well as being a mom as well. So, and I've seen, so when we talk about nutrition as well, some of them won't even realize some of the symptoms they're having because they don't have proper nutrition. And so all I'm saying with that is that heartburn can be alleviated. So many times pregnant moms think that heartburn is inevitable because as the baby grows, of course, it's putting more stress on where our stomach is and abdominal organs. And it isn't necessarily due to that. A lot of times it can be due to some of their nutrition. So we can help with that. If they're not sleeping well, it can be due to nutrition. I can work with that. The other thing I educate my moms on is that you really need to be aware when the baby starts moving after 20 weeks, be aware of their time. So when they seem more active, so that you can know what to expect. So if you have a baby that you feel is very active at 2 a.m., be prepared, because that is going to happen when the baby's birthed, as well as during the day. Also to really kind of associate maybe things sometimes when you eat, they may feel more like they're getting hiccups or agitated, that kind of stuff. So I really educate them to be aware of what the fetus is doing.
And that's got to be so helpful, because this is just the start of this child's
Yeah.
life. You know,
Yes.
it's like almost like the kind of the warm up, get ready of like, you know, because when the child is born, it's even more so. So why not start to get in tune with the needs and wants and thoughts of your
Right.
child? Like, here you go. Here it comes.
And as a woman who obviously had children, that when you're pregnant, you think, oh, I just can't wait. Most of them, I will say, oh, I just can't wait till I have this child. I'm so tired of being pregnant. And I'm like, yeah, well, you just be prepared, because the work is starting then.
And I think 3 sons?
3 sons.
How old, do you mind me asking, how
Yeah.
old are they?
Okay, 32, 30, and 25.
All right.
Yeah, so they're all grown, 2 with families, and the youngest one just hasn't been caught yet.
I gotcha. I just have to imagine the relief that a pregnant woman must have, like coming to talk to you. That you have all this experience. I love that. You know, not only are you a chiropractor and you can do the nutrition counseling, but you've been a mom. You are a mom.
Right.
You've gone through this. So I have to imagine, and I'm going to guess, especially with women who are having their first pregnancy, you must be just a wonderful resource.
Oh, absolutely. And so I feel very blessed to be able to be a resource. And I did not have easy labors and deliveries, so that's been helpful as well. Anybody who does have an easy labor and delivery, that's awesome, because, you just don't know. You really don't know. As much as I'd like to say chiropractic is very helpful, if someone can stay adjusted, understand their nutritional needs, sleep well, exercise well, do what they can to understand what's going to happen in labor, there's still no prediction as to how exactly your labor is going to go. And yes, there's a lot of research to say that if you stay adjusted, your body's balanced, like I said, you're nutritionally sound, sleep well, that you should have a better labor and delivery. But what does that really, look like? I'd like to say that I have helped, and so has my husband, with adjusting pregnant women who the babies are breech presentation, meaning that the head is up, not down, and we've been able to get them to turn. Because a lot of times it's the pelvis being locked up that the baby cannot engage, shall we say, with the pelvis. So that's been a blessing. But not everyone, as much as I'd like to say everyone that I've treated who's been breech, that the baby's turned. But we have quite a few of them that have turned, as well as then we can prepare them for the next stage with labor and delivery too.
That's amazing. So that you're able to... So do you get referrals? Would there be a physician that would see that this is happening and they'll say, maybe go see a chiropractor?
Right. Yeah. Now, and of course, that's been wonderful in the area because we've helped to educate them. You know what I mean? If we were first here, that relationship may not have been there. But since we've been here long enough and they've seen changes, and they've seen it in other areas too, since they deliver in, like I said, Medford usually, or Ashland or Minocqua. So there's chiropractors in those areas who've also educated. But so, yeah, we're seeing more referrals instead of them having to go through other processes to possibly, what do we want to say, turn the baby.
Turn the baby. You mentioned heartburn, and that's something I didn't even think about coming into this conversation. Are there other symptoms or that women have going into pregnancy that I probably wouldn't have thought of?
Yes, some, there's rib pain sometimes. There is how do I want to say, bowel issues, There is headaches. Headaches is a big one, and a lot of them are dehydrated. They don't realize it. What have I usually
Don't
gotten?
mean to put you on the spot there.
Yeah, no, I have to think.
Here, I had a conversation with one of your associates here at NorthLakes.
Dr. Jordan Oin.
Dr. Jordan, thank you. Sorry, Dr. Jordan, pardon me. But when I talked to him, we just kind of talked about chiropractic in general. I was just really amazed at the things that you're able to do for people in general, and that has to really transfer to people who are pregnant. It was just, he talked about someone, that there was someone who had an earache, able to help them with that. And I just love learning about what you do, like what chiropractic care is.
Right. And again, hopefully he stated that, we look at health from the inside out. And so when people are having issues such as symptoms, a lot of times it's coming from, the body or the nervous system, as well as improper motion of spinal joints, cranial bones. And so if we can help affect that so that we get to the cause of the condition, shall we say, that if we can help them and then help, obviously, their symptomatology, but then help them from re-getting it, it's a blessing. And with it, I'm sure Dr. Jordan had said, too, if there's something that we feel does need possibly medical attention, we'll get them there, or we'll work with the medical provider. Another one that pregnant moms, and I think about it, can get, but other people, is vertigo. And vertigo is something that chiropractic has had so much success with, because a lot of times they're just in the upper cervicals, the upper neck, as well as the occiput is so restricted, it's causing the stress to the area to cause the vertigo, or we're affecting the cranial nerves, obviously. So
I had vertigo, so I can relate to that.
I've heard it's awful.
The thing that helped me is that there's this move you do, because you're the professional.
Canalith repositioning.
Yes, okay. But it's because there's some substance in your inner ear that, and what you need to do is you need to move your body in a way that the whatever that is kind of floats up to the top and gets out of the way. I'm
Correct.
being very generic and
yeah, it's almost like, some will say it's like a crystal of sand, or a crystal in there, or a bubble, like in a level, and that level is off, and so you have to get that level back up so it understands. Because vertigo, it's just trying to get your balance, or get you, like you say, head above water is what am I trying to say, but it's trying to get your balance, and so that's what it is. So yes, that move is very effective to get that level or that bubble or that crystal back into where it needs to, alignment, shall we say.
Oh, thank you for reminding me that I had it, and that I'm thankful that I don't.
Yeah.
Because it was not fun. It was bad. So you speak. One thing I love about being here at North Lakes, and you've practiced, in private practice now, being here, but I have to think that it's really helpful to have other services that North Lakes offers, so that you can make recommendations or referrals to other services we offer.
Yes. So another thing that when I deal with a pregnant mother, and then after she has the baby, I almost always tell them, you need to come in with the baby. I need to check this little one out as well, because, to be birthed is so traumatic. It's the only way you're coming out, though. So it's very traumatic. But with that, then I do check the infant for misalignments, other things. Ask the mom questions on how everything went, if they're nursing well, how they've responded to vaccinations if they've had them, how they're sleeping, different things, so that we can curtail some of those situations as well. You hear of infants having colic or developing ear infections, or, abdominal issues or reflux. So if I can hopefully help stop some of those from occurring by understanding how birth went, if there's areas that need to be adjusted, and then work with the mom to answer their questions. So a lot of times after that, after they have the infant, I will see that infant for a while, and that if they do have any symptoms, I educate them on getting them in to us first. Because, as an infant, they're a bundle of nerves until they fully develop, and it's the way that we are. So it's helping their nervous system to kind of regain its balance. I'm sure you've heard of, mothers have said, if I put him in the car, he does fine and he'll sleep, but out of that he won't. Well, that's just because their nervous system's so unbalanced. So to get to your point, not just with the pregnant mom, but with the infant itself, to have some of the services that NorthLakes offers. So I will work with OT if that's a case. And I know this is young, but as they grow and develop, or if they have questions, we have OT, we have behavioral health, we do have medical. So yes, it's nice to have those resources as well, and very good people in those positions to work with.
And so, how about after a pregnancy? How are you able to help women? That was a major, as you said, a kind of a major change in their body. So I imagine post-pregnancy, there must be some adjustments that need to happen as well.
Yes. And so some women may not have any back pain during pregnancy. They go through labor and delivery, and then they have back pain. So I, obviously do a history or, exam and go that way as well, but their pelvis can be really not in a position. It may have really restricted during the labor and delivery. So yes, I'll work with that. Headaches may occur. We go through nutrition again. They may not be sleeping well, like I say. They may have bowel issues, and then the way that they, with breastfeeding, their posture with that, the way that they sleep. They may sleep, not as well. They may sleep in a different position because they're always aware of, if they have the crib in the room, something like that. So yeah, there's other things. They may have developed some heartburn or acid reflux after. So yeah, we go through and of course adjust, but go through nutrition and other things with them then too.
You can do it all.
I'd like to think so, but it is a wonderful gift to be able to give, because yeah, it's tough. It's a tough thing to go through. It's so well worth it. But yeah, if you have resources to help you to know that it's okay, or what I'm feeling is normal. With that too, a lot of moms want to get back into an exercise program, and knowing when to do that or what they need to do is something I work with as well. And
but with an infant, you can and I'm just thinking, birth, they go through this moment, and they don't always come out, their spines aren't totally straight, and so even with a young infant, you're able to help make some adjustments and kind of get them settled.
Right, and it depends. We ask questions like, were they birthed with forceps or with the vacuum? That's very traumatic. Were they head up? Were they face down? Did they have to be turned? By the medical providers if they were breached. There's just a lot of C-section you would think would be less stressful, to actually more stressful on an infant, because they don't go through that proper. And so they don't go through, shall we say, the birth canal. And what the birth canal does is the head, the cranial bones kind of telescope over each other, and then when they come out, they go into place. Well, you don't have that when you go through the cesarean. So a lot of times I have to work with the cranial bones as well as the cervical spine. So yeah, there's just a lot of different things we don't think about, or we think would be less traumatic, that can be more traumatic, as well as they don't get their probiotics if they don't come through the birth canal from the mom. So then I always say, if a child has been birthed through C-section, they need to get on a probiotic right away, or the mother needs to take more if she's breastfeeding so that the child gets it. So yeah, there's a lot of intricate things you don't think about that I can help with.
What you do, thank you. I just think it's so.
Well, thank you for appreciating it, especially as a male.
Yeah, well, I just, like here, my job here is I record things and draw pictures in the marketing department. I'm really always so impressed when I speak with our providers and what they do and what they're able to offer. And you just did it to me again. So. Well,
thank you. But we're very impressed with you because I am not tech savvy. So all this I could never have done it. So I feel really I feel very honored to do it, but I would never have tried to do this myself. So thank you for giving me this opportunity.
Of course, I've got all the cool microphones and stuff. So.
Yes, you do. Cool equipment.
But what's that? When I spoke with Angie Shepik, what I loved, I asked her just who does an OT up in Ashland.
Right. She was wonderful, and she's just a wonderful provider.
But I just love, what's that? That must feel so amazing to help, I would say especially an infant, but anybody, when they come in, you're able to help them out, make those adjustments, and they just leave, better. Feeling better and happy, and that must be an amazing feeling.
It is a good feeling. And when we talk about, mothers and kids, oh my gosh, if we can do something to help a mother's life be easier too, yeah, that's a blessing. So if a child has colic or if they're not sleeping well, to educate them on that. Or if they're not feeling well, to help ease some of that pain or headaches. Yeah, it is. It's a blessing.
Excellent. So I have one last question for you. It's kind of a funny question I ask everybody, and I'm just prepping you.
Okay.
What's in your car right now?
What is in my car? Oh, I will tell you what's in my car. So my husband calls me the bag lady. I have all these bags because I hate the plastic and that from grocery stores and stuff. So I have, he'll tell you I have hundreds of them. I don't have that many. But I've got a lot of the reusable bags in my car. And I take them with me wherever I go.
I do too. I'm happy to hear that. Yes, I do. Well, a couple. I have one. You can see it's on my bag over there. Well, maybe you can't see it there. But anything else? I mean, I did that you want to cover? We covered quite so bit. Is there anything else that I missed that I might have should have asked you, or anything else you want to say before we wrap this up? I will just say one of the questions that you did have for me that we didn't go through is there any time a pregnant mom should not see a chiropractor? Oh, yeah.
And that's a really good question. I may not have the best answer for you, but I would say that what I was taught is that, if a woman is having, obviously, bleeding, something like that, of course, I would say, nope, you need to go make sure everything's okay. Sometimes they talk about premature labor. If they're having that, I would certainly have them be checked out from their provider before I would ever look at anything. If they're having headaches that are very strong or abnormal that I'm not feeling comfortable with, I would have those checked out. There's just different things that you have to know or be aware of before you decide to adjust somebody. The other thing with that is if the mother is feeling there's something wrong with the fetus, I would have that checked out before I adjusted them. So.
And another thing I just love about the collaboration of not just within North Lakes, but I feel in the whole healthcare community, is you all work together.
Yes.
You're not going to say you're going to be the one that knows everything and is able to do everything. You do what you can, but then when something else comes up that's out of your reach or out of your scope, you're like, nope, you got to go to this person.
Right, and that's what makes the collaboration work so well, so that when you have trust among the providers, if, let's say, I had a pregnant woman and she went in and said, I just was going to go in and see Dr. Wakefield and she's not comfortable this, will you check it out? They do not. They're like, absolutely, and then they'll say, nope, you should be okay to go back and get adjusted. So that's nice. Instead of saying, oh no, you shouldn't do this or you shouldn't do that, because they trust our judgment as we trust theirs. Mm-hmm.
Just like you trusted me to do this with you today.
Yeah, it's been fun. I hope you've enjoyed it. I have.
Oh, of course. I love them all. Dr. Lorelei Wakefield, thank you so much for being here. It's so nice to speak with you.
Well, thank you. It's been wonderful.
All right. Have fun with the rest of your patients today.
Yeah, you have a great day.
Okay. Talk to you soon.
Bye.
Well, I think that went well. I certainly learned some things. Thank you for the conversation, Dr. Wakefield. It was great speaking with her and getting to know her better. If you would also like to talk to her, schedule an appointment. She's at our clinic in Park Falls, and you can call 715-762-2950 to get on her schedule. NorthLakes Community Clinic is a community health center with 13 locations throughout northern and northeastern Wisconsin, working to remove barriers to wellness by offering an integrated array of quality services. Our clinics are located in Ashland, Birchwood, Chippewa Falls, Hayward, Hurley, Iron River, Lakewood, Minong, Oconto, Park Falls, of course, Turtle Lake, Washburn, and White Lake. Our vision is healthy, prosperous, engaged communities where everyone thrives. I'm Jeremy Oswald, and I work in the marketing department, and I am lucky enough to get to have these conversations with our providers. They are such a neat group of people. If you are wondering what's in my car, I've got a bag of golf discs, 2 or 3 ice scrapers, and a bunch of CDs. It's a 2009. What do you want me to say? If you gave this podcast a review and shared it with a friend, we would really appreciate it. Any help you can give would be great. Thank you so much for listening to the NorthLakes podcast.